The theme for World Hand Hygiene Day 2025, it might be gloves, it's always hand hygiene. It highlights the fact that while gloves are important, they cannot reduce the need for proper hand hygiene. Proper hand hygiene before and after the patient contact is essential to reduce the transmission of harmful pathogens and to ensure the safety of healthcare workers as well as patients.
Hand hygiene is one of the important steps to stop the spread of harmful pathogen. So the healthcare workers as well as public should understand one thing is gloves are not the only method where we can stop the spread of these harmful pathogens. So hand hygiene should be performed after seeing each patient as well as when you touch a surface or any other activity that will increase the chances of getting these harmful pathogens.
The steps for proper hand hygiene starts by wetting your hands and applying enough soap on all the surfaces of your hands. Rub your hands for at least 20 seconds, making sure to clean every area. Palms, back of your hands, between your fingers and under your nails. Finally, rinse thoroughly and dry.
The 20-second rule is crucial in ensuring a thorough hand washing. Simple way to ensure that you wash your hands for a proper amount of time is by singing a happy birthday song twice. This will ensure that you are proper and thoroughly washing hands, which is key in protecting yourself and others from infection.
Hello, I am Dr. Sri Harsha, consultant nephrologist in SPARSH Hospital, Yelahanka. In healthcare, infection control is paramount and good hand hygiene is at the heart of it. Proper hand hygiene before and after patient interaction and after handling the medical equipments and surfaces is not only essential but important. It is essential to remember that hand hygiene is not only essential for preventing infections but also to inculcate a culture of safety among patients and our colleagues or our co-healthcare workers. Thank you.
We as healthcare practitioners have to keep in mind 5 hand hygiene practices to prevent pathogen spread and to protect the patient's safety, like using hand hygiene before touching a patient, after touching a patient, after touching the patient's surroundings, after coming in contact with the patient's bodily fluids, and before performing any aseptic procedure. Thank you.
In situation where soap and water are unavailable, alcohol-based hand sanitizers with 60% alcohol are the preferred alternative. However, when hands are soiled, hand sanitizers are less effective. Using soap and water is the preferred method in these situations.
As we continue to confront new health challenges, hand hygiene still remains the important aspect. Hand hygiene practices is a key component in not only protecting ourselves but also protect the broader community from the spread of infectious diseases.
In conclusion, as we observe the World Hand Hygiene Day 2025, it's important to remember that hand hygiene is not just a healthcare practice, it's a global responsibility. By making hand hygiene a part of our daily routine, we contribute to reducing the transmission of infections. Let's continue to prioritize clean hands for a safer healthcare environment.